Hello everyone, welcome to Geo Info by YouTube channel. My channel is motivation, understanding, easy learning and knowledge and innovation of education to awareness related to health. Everyone useful news will become to you. Today we can see one topic related to COVID-19. Today topic is COVID-19 means coronavirus. You know everybody very well about the coronavirus. Like we can see what are the coronavirus. Coronavirus is spreading the global nowadays full globally spreading the coronavirus. But important is taking the necessary measures for them. Coronavirus is a disease. Is named by the WHO organization in 11th February 2020 like COVID-19 as a COVID-19. World Health Organization WHO declared to a global emergency in 13th January 2020. As investigation is going on, determination of more effective out of break. This picture you are seeing, this is a coronavirus virus pictures. Coronavirus means what? First, what do you mean by corona? Coronavirus. So named is called like a crown like appearance. That is called coronavirus. Is a virus is a cause of respiratory problem related to one of the signs, throat, lungs, and nose, and among to other respiratory areas. Coronavirus are large number of family of virus which may causes of illness in animals or human. In humans, several coronavirus are known as to causes a respiratory infection from the common cold to more severe diseases. Middle East respiratory syndrome (MERS) and severe acute respiratory syndromes (SARS). The most of recently discovered the coronavirus causes of coronavirus disease like COVID-19. Coronavirus means what? Coronavirus is a parasitic organism that is excited to Amorophusilla is a unsafe like no safety that is meaning. Without a cell membranes, a virus cannot be repeated itself unless he is attached with the cost. The need to any cost of person that is a human being for them. What is the difference between the main thing is difference between epidemic and pandemic? The a pandemic, first one is we see the what is the epidemic, what in by pandemic for them. For example, epidemic means first one is epidemic is a spreading throughout the entire the area. For example, whole one country can spreading for them. For example, now corona is spreading overall the world like, but that like is the for the pandemics. For epidemics particular area like, so first we can see epidemic means particular rural region or area or community, they're affecting only them for them. Next, that is another one is epidemic. Second one, longer continuity, this is gonna to longer cannot continue for them. Next one is find out the problem means we can pick control, what is the problem causes we can find out, we can to control the problem. Next one is particular time or that places only to affected. For example, India Nipah virus 2018 affected for them, Apollo virus in world 2013 affected, chikungunya 2006 affected. Same like pandemic means what do you mean pandemic? Pandemic is pandemic means spreading like, for example, all over the spreading for the world. For example, this virus no longer contaminated for the entire area beginning affect the countries. Full country should be affected. Enter the world should be affecting with the coronavirus. First one, if we see spread across the entire the world, already I told, and spreading with the fast geographically, very geographic area for geographically everybody, and whole country should be affected. They are spreading for everybody to very well. Whole country should be now affecting with the coronavirus, especially China, Italy, America. So many countries are affecting, and large number of people are affected for them. This is a coronavirus. Example, COVID-19 2020, that's a pandemic disease for them. The coronavirus mainly we can see what is the incubation of coronavirus. Incubation period means duration. For example, according to WHO, they're saying for incubation period is between the COVID-19 2 to 10 days. People are seeking the virus mean 2 to 14 days before developing the symptoms. That is the incubation period of coronavirus. Sometime 27, 28 also is there showing the symptoms. They're later to admitted hospital. Next one is the age based coronavirus, the death. What are the age based coronavirus deathing for them? First one is age based. More people are old age people affecting with compare with middle age and low age people for them. This is a death rate for them. How much death rate going for according to confirmation with old age, and death rate for the death rate for the children's and affect other people also. And sex ratio, what which person are more affecting, especially males are more affecting death rate for them compared with the female. And confirmation cases is more also male also, and death rate is also more affecting for compared with female. Is a 4.7 for confirmation rate, and death rate is 2.8 percentage, female 2.8 percentage confirmation rate, and death rate is 1.7 for them. Next one is cases of overview. This is the whole country. What are the cases is there? You see the first one is whole ways. For example, more than in world which 2 lakhs 392 was comma 1699 people are should be affecting 2 lakhs 3 nine for people should be still affecting for corona. For India 17,615 people should be affected for in India. Death rate is, for example, whole world 1 lakh 64,391 people are in death rate is there. For India 559 is death rate is there, and recovery rate is 6 lakhs 14,756 people are in recovery is there in hold base. In India, 2,854 recovery rate is there for them. Next, go for next stage, mode of transmission. How can the transmission of for them? First one is mode of transmission. Like the main mode of transmission is droplet infection. Because of why the droplet infection, the microorganism into the droplet infection for them, one person to other person, and coughing, sneezing, and airborne transmission, and direct contact with the infected person, and indirect contact with any surface or touching the articles or anything, etc. Human to human also transmission, working place, suppose you are doing, or sometimes there you the equipments you are using, like that type also transfer for them, touching the articles, that also can transfer for them. The mainly human to be that also. Next, incubation period, mainly that coronavirus, the symptoms will be, signs and symptoms will be showing for them. Next one is passing the virus along to other, even through they're showing the no symptoms and in the coronavirus, sometimes there are no symptoms while also showing their patient. Next one is what are the signs and symptoms for coronavirus. First one is fever. This is a normally you can see now detect for everybody, fever is recording. If I have dry cough and try and difficult to breathing, severe and first who all are. Next one is vulnerable. Who all are chances to maybe chance asthma, diabetes, heart patient, blood pressure, lung diseases, coronary respiratory illness, immunity compulsory individual, cancer, HIV patient, diabetes. These are all people are maybe chances for them vulnerable group, they can chances to spreading for them. Sometimes even to even the spreading, especially old age people more affecting pregnancy, pregnant women and children's old age persons are should be affecting more chances is next. Shortness of breath is there, aches and pain also is there, sore throat is there, headache is there. Very few people are will be reported diarrhea, nausea and running nose, and sleepiness and fatigue also is there. If you see the picture how there, shortness breathing, running nose, that and cough and fever, headache, these all main symptoms you can see. Next one is investigation. Mainly investigation they're doing for them, travel history, find out the travel history and close contact anybody person or any your affected country should visit or not, that like a everything. Next, individual symptoms can be seen, individual symptoms can be seen. For next one is blood test, they're doing time, they're doing for blood test, especially for them temperature checking for them, they're doing the temperature checking to the patient if affecting any corona or not. Next one is that is another one is corona covid-19 igm ig immunoglobulin moleculars and immunoglobulin G, the responding or serum antibiotic rapid test kits they're doing, also they're doing for them. how their our immune system will be reformed. Next one is first few x number of cases there are close contact with primary investigation. Anybody is there or not? Next one is householding transmission of investigation. How many householding to transmission of information? Next one is healthcare workers and old age of risk factors for them. Sir, you can check. They have check for especially upper respiratory who all are having upper respiratory inspection. They have checking a single way swab. That picture you can see how they're swapping. They're using for throat and nose. They will be doing checking for them. Rover respiratory tracking sample also sometimes sputums collection also if you taken for the doing the optimal for them. Next one is treatment. What are the treatment is there? First one is children is a better rest to take more fluid intake and away from others, mainly for them quarantine very important. Do not take any kind of self medicines. If you have any pediatrics or diabetes, that like means you can, that regarding as per prescription of doctor order, previously you can take medicines. Now do not take any corona regarding, do not take any your self medicine. Next one is avoiding the close contact with person to suffering from the coronavirus. Frequently hand washing you want to do for them, soap or sanitizer compulsory, and maintain social distance 6 feet apart from others for them. Next, coughing or any sneezing is there, using tissues or tissue papers or disposable or cloth you should be want to use. And are mask compulsory should be one bit for you away if you away from the home means avoiding touching your eyes, nose, mouth repeatedly should be don't touch too for your eyes and nose. Stay your home will you are sick also. Drink plenty of fluid and rest are in all people also. If you have in your house old age people anybody is there to making, if you have anybody affected corona to quarantine with them, to children should be don't go with near with him. In some cases of developing phenomena of require hospitalization, they will be want to go for the hospitalization. If possible, to avoid the traveling places, moving on or here other places unnecessary as per government's order should be compulsory, strictly should be follow for them. Cover your nose and mouth with mask. Next one is trim your nails and once a week keep the clean and dirty free. Actually, this is also one of the things to keep it in your mind. Next one is how to save yourself. For example, stand back. For example, the stand back means the WHO trusted source just to staying the, at least 6 feet away from the people to the basic who all are affecting the people away the 6 feet. Second one, hand washing your hands frequently because of 20 seconds compulsory should be one to hand washing with sanitizer or soap. Next, use the any alcohol spirits of hand sanitizer. At least you have, if you do not have access to any soaps or water, looking product for the at least 60% of alcohol them. Next one is same time one keep it mind, if you alcohol any sanitizer also suppose using, especially female, if you're going to kitchen, don't gas on immediately because of that sometimes skin infection also, skin affected chances is there. So wash again properly and clean and again to running water and go for the running for cooking purpose. Avoid touching your face. Already I told mouth, nose, eyes. Unnecessary should be avoiding. That is very important. Your maximum spreading of coronavirus transmitter should be releasing for you. Next is stay home and stay safe. That is a social very important. You are maintain the social systems of group of people help to avoiding being the exposing for them. This picture you have, I first picture 6 feet should be maintained. Their hand washing with soap, mask compulsory. This is a method of hand washing. If you want to see, search in Google and see also, and you use the mask and gloves. And if you are going to hospital or anything, also stay home and stay and work with home also and safe also. Next, when you are hand washing, when to you are washing hands before handling the foods, before you are after eating the foods, before giving any medicines, when your hand has should be tired, you can feel dirty, sorry, when your hands are dirty, that time you are compulsory use after using the toilet also. And you are after contamination of any fluid, mucus, saliva, etc, whatever there you can do, that time compulsory you want to wash after contacting any contaminated surface area or like you can want to wash after playing in playground. Suppose nowadays no should be go for playground, indoor should be game want to play for after handling any toys birds cases also you want should be washed for them. Next one is what type of nutrition food you want to take. Nutrition is very important for them human being. first one is you want to take balanced diet, immunity foods, like boosting your immunity system, like foods you want to take for dairy products should be milk and yogurt, cheese also very necessary, meats and etc. Also nuts, beans, vegetables, fruits, cereals, soups and hot water with the ginger, honey, that's also you can take for your daily foods for them. Next one is pregnant woman awareness. What is the pregnant woman should be taking the precaution? First one is pregnant woman, do not get any panic, more like contract with any infected person, don't get any panic. First one is first one is you quarantine yourself. First one is, next one is you have at present there is no record for cases of any, especially in breast milk to test to positive covid-19. That is not pregnant woman compulsory want to social distance maintain, reduce number of antenatal visit to hospital also, do not delay any abstract management in order to testing for the covid-19. Suppose your fetal kick count should to be maintained properly, and fetal monitoring very very important. Unless symptoms being severe, you call the ambulance also. Previously tested negative for covid-19, if she is present with symptoms again covid-19 should be suspected, that cases should be suspected mother only. Mother confirmed the covid-19, separate rooms, face mask and practice hand hygiene before eating, before each of feedings also very important for her. And who are caretaker care people also, they want to take care baby and newborn very carefully for them, there also should be maintained the hand washing, hand hygienic very compulsory for them. And separate room should be keep it for them. Mother supposed to be affecting with corona also to treat for them. Detect for breast pump will be available for them. Suppose mother is affecting covid-19, so they given breast pump to milk to also to given to milk to the children's also. That also should be every time your proper hygienic should be maintained for them. That is all things are should be pregnant women to awareness. Next, exercise. Exercise we are very very important our human life, where exercise is a control for a weight, and exercise is a comfort for health condition and disease. Exercise improve your mood, exercise is boost your energy, exercise promote your better sleep, exercise can be help, exercise can be help for you and your mentally keep it your well, that also very helpful for exercise promote to better sleeping also. Exercise can be make feel young healthy human being, that also very helpful for them. Next one is mental hygiene. Mental hygiene very very important. Mental hygiene, for example, try to enjoy your life will fulfill, don't worry about yourself first. Panic buying for is an ego reaction to fear, don't get any panic regarding to the covid-19. Do not waste your time and energy working unnecessary for work for them. Next, organize their lives of functional, what you are want to do for important things, what you do in do done by the timing, that is very important. Next, can be love with your family members, enjoy with your family, sorry, enjoy with your family members without, don't get any fear. And group communication should be maintained for them, and group call should be maintained for them in their family video call, etc. You can to talk with every friends also. Cannot find inner space, what is the space of and strength when you need it for, that is very important. You see the so many uh, laughing or for example, you are seeing so many movies and enjoying for them, and to keep it your mind to cool and calm, like for a, that is a very important. Find humor for the situation to enjoy the jokes, etc. Watching the tvs like, so don't get any violence regarding doing for them this type of situation. Good movie you should be watch for them. Look for the solution instead of on comedy also. You can look for solution instead of complaining of about the problems. What are the problems should be, you can do solution should be make, act their own self interest. You are according to you make your self interest very very important. Next one is song and consent to set the values, what are their values you want to. Next one is face the new ideas, you can make the very new ideas open minded sector. This is very important for you. Tell to your family members, creating what is your plan in your future, discussing everything also in for them, and co-relate with your children and play with your children, and your hobbies doing for them. and your childhood hobby also recall and do for that type of activities, and guide for your teacher and tell, listening the listening any good musics, or other ways you can do, hearing the songs, or watching the good program from TV, comedy base, or watch good movie for them. Apart from, check your regular medicines, food or materials are available in your home, that is also keep it. If you have any diabetes or hypertension patient is there, antenatal mother, anybody is there, you want to check for your medicines regarding, you want to check and keep it mentally hygienic. Mental hygienic very important for them. Avoiding using tobacco, alcohol, other drugs, especially this time to spread for them more causes, so it should be avoid compulsory for them. In demands, our toll free helpline should be number given. If you have any mental related issues, you can talk with them. Next one is home activities. What are the home activities doing for them? First one is yoga and medication. Next one is brain and storming for them, you are doing for them. And brainstorming activities were any like gaming, mobile, that like you are doing for them, using the learning apps, online courses, so many is there. And upcoming I video I will be uploaded for regarding the online courses also. Watching inspirational cinemas, you can watch for them related to the subject related, also you can do other related. For example, you are good for me for them, watch your any subject oriented videos in YouTube, whatever channels, or in Google also you can utilize for research for them. Make your daily schedule respect to humanity for them, to clean home and rest for them, spending with the time with your family, and positive attitudes also, helping female and householding activities also, help with your mothers and family members also. And indoor games should be play chess, for example carom, like you can play for indoor games also. Accept the situation, acceptly ask it. Nowadays every no quarantine is compulsory, should be one to follow for them. Still we have no medicine for covid-19, so everybody should be accept for the situation. We have no ways to way to, this is from prevent from the covid-19, so keep it mind. Be no judgmental, do not get any judgmental to wrong way, don't decide for, don't believe for any fake news is also. And whatsapp or social media, so don't fill in for them unnecessary false information regarding. And educated to your children to simple how can life living for them, this type of situation how can to managing for them. And stress management, this should be also the, for example you are doing for any activities related work for them. If you are having with drawing, you can do drawing, or so you are doing some cooking very well, you can do cooking activities. You can do, you are reading books also, you can read your favorite books, or listening the favorite musics also. Whatever there you are do home activities, keep it safe also. Next one is, as a our government, as well, main things keep it your mind for them. These five things, first one is for stay home save life, that is help to stop the coronavirus. According to Google says for them, stay home, keep a safe distance, wash hands often, cover your cough when you are coughing time, sick if you call the helpline. This is a keep it your five things, keep it your mind for them. And this all I have a reference for so many books and journals and so many website I am doing for them. I keep it show for this all thing reference related to this PPT. Next one is, thank you so much support me, please subscribe Geo Info5 channel, do not forget click the bell icon, say and notified me. And for them, be safe everybody. And thank you so much supports. Thank you for joining with us once again.
இதுவரை ஜெயம் இன்ஃபோ 5 சேனலை சப்ஸ்கிரைப் பண்ணாதவங்க கீழே இருக்க ரெட் கலர் சப்ஸ்கிரைப் பட்டனை கிளிக் பண்ணி சப்ஸ்கிரைப் பண்ணுங்க. கூடவே பக்கத்தில் இருக்க பெல் ஐக்கனை கிளிக் பண்ணுங்க. இது போல அருமையான வீடியோவை உங்களுக்காக காத்து